Preventing type 2 diabetes. Preventing type 2 diabetes, is it the problem you were looking for? All of the following information will satisfy your needs. Perhaps you have learned that you have a high chance of developing type 2 diabetes, the most common type of diabetes. You might be overweight or have a parent, brother, or sister with type 2 diabetes. Also, maybe you had gestational diabetes, which is diabetes that develops during pregnancy. These are just a few examples of factors that can raise your chances of developing type 2 diabetes. Diabetes can cause serious health problems, such as heart disease, stroke, and eye and foot problems. Prediabetes also can cause health problems. The good news is that type 2 diabetes can be delayed or even prevented. What's more, the longer you have diabetes, the higher your risk of health problems. So delaying diabetes by even a few years will benefit your health. You can help prevent or delay type 2 diabetes by losing a modest amount of weight. However, you must stick to a reduced calorie eating plan and physical activity most days of the week. Ask your doctor if you should take the diabetes drug metformin to help prevent or delay type 2 diabetes. Reduce risk factors. Help prevent type 2 diabetes. You can do a lot to reduce your risk of developing type 2 diabetes. Here are some things you can change to lower your risk. Lose weight and keep it off. You can prevent or delay diabetes by losing 5 to 7% of your initial weight. For example, if you weigh 200 pounds, your goal would be to lose about 10 to 14 pounds. Move more. Get at least 30 minutes of physical activity 5 days a week. If you have not been active, talk with your healthcare professional about which activities are best. Start slowly to build up to your goal. Eat healthy foods most of the time. Eat smaller portions to reduce the amount of calories you eat each day and help you lose weight. Choosing foods with less fat is another way to reduce calories. Drink water instead of sweetened beverages. Ask your healthcare professional about what other changes you can make to prevent or delay type 2 diabetes. Most often, your best chance for preventing type 2 diabetes is to make lifestyle changes that work for you long term. Prepare your mind for prediabetes. Prediabetes is when your blood sugar is higher than normal, but not high enough to be called diabetes. Having prediabetes is serious because it raises your chance of developing type 2 diabetes. Many of the same factors that raise your chance of developing type 2 diabetes put you at risk for prediabetes. Other names for prediabetes, such as impaired fasting glucose or impaired glucose tolerance. Also, some people call prediabetes borderline diabetes. About 1 in 3 Americans has prediabetes, according to recent diabetes statistics from the Centers for Disease Control and Prevention. In the meantime, you won't know if you have prediabetes unless you are tested. Lose weight if you need to, become more physically active, and follow a reduced calorie eating plan. For more support, you can learn the story about how to reverse type 2 diabetes and diabetes freedom. Preventing type 2 diabetes during pregnancy. Gestational diabetes is a type of diabetes that develops during pregnancy. Most of the time, gestational diabetes goes away after your baby is born. Even if your gestational diabetes goes away, you still have a greater chance of developing type 2 diabetes within 5 to 10 years. In particular, your child may also be more likely to become obese and develop type 2 diabetes later in life. So, making healthy choices will benefit the whole family and can protect your child from becoming obese or developing diabetes. Meanwhile, being physically active together is a great way to reduce your own and your child's risk of type 2 diabetes. Here are steps you should take for yourself and your child if you had gestational diabetes. Get tested for diabetes 6 to 12 weeks after your baby is born. When your blood glucose is still high, you may have type 2 diabetes. Also, if your blood glucose is normal, you should get tested every 3 years to see if you have developed type 2 diabetes. Be more active and make healthy food choices to get back to a healthy weight. Breastfeed your baby. Breastfeeding gives your baby the right balance of nutrients and helps you burn calories. Ask your doctor if you should take the diabetes drug metformin to help prevent type 2 diabetes. Or you can refer to how to reverse type 2 diabetes without drugs or insulin has been successfully applied by many people. Note: Diabetes is a dangerous disease with many complications related to the kidneys, heart, liver, and causes many serious health effects. Understand the causes and prevention of the disease so that you can promptly treat the signs and symptoms of the disease. The purpose is to solve your problem. So be open and ready to experiment. At the same time, choose your strategy, take action, and start enjoying the benefits. Reference: Diabetes Freedom, 2 months free solution. Or visit 247naturalhealth.com to all chronic illness information. Link in the description. In particular, if you know Qigong and its miraculous improvements to health, visit falandafa.org. Thank you, I hope you are always happy and healthy. Thanks for watching. Don't forget to subscribe to the channel to receive useful information.